morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Welcome to Health Talk, which begins every Thursday morning at 8:35 right here on the voice of Morgantown, WAJR. I'm Jim Stallings along with Kay Murray. Good morning, Kay.
Good morning, Jim. I'm here.
And welcome.
Where's our guest?
Well, Nancy Ord is in here.
The most important.
She was in here was it just last week you were in here?
A couple weeks ago. Nancy
Ord, she has a real long title with Mon General Hospital, Director of the Emergency Department. I guess it's not that long now that we think about it. And we also have Dr. Rick Smith, who's settling into his chair right now. He is a cardiologist with Mon General Hospital. Dr. Smith, good morning.
Good morning.
Welcome to the program. Also, we have Eric McGuire, patient of cardiologist Dr. Rick Smith. Good morning, Eric.
Hi, how you doing, Jim?
I'm doing just fine. I'm going to let Kay handle most of the interview today because it's not going to be easy for me to interview Eric without, I guess this is kind of a serious show, and I can't be
When
that.
did you
I can't be
stop
that way
making
with Eric.
fun having fun? You always have fun
Well,
on this
I always
show.
have fun making fun of Eric, especially right to his face. And since this is kind of a Mon General show and it's not my show, I'm going to have to withhold myself today.
One of these days I'll have to tell you, Rick, about flying Jim Stallings with me on my airplane and crashing into a hillside and breaking my plane in half.
Coming down, boom, boom.
And that was the beginning of Eric's heart problems, right there in midair. But Eric, what kind of procedure did you have on your ticker?
I had a cath. I had a heart attack. I had the heart attack going on while I was here working one morning.
So what were your symptoms?
Just heavy pain in my chest. I thought it was indigestion. I just thought that's all it was. Went home, couldn't get comfortable. Found myself going to every chair in the house trying to get comfortable. It was very strange.
So had you had any tests on your heart prior to that?
No. Never had any heart problems. My family really hadn't had heart issues, so I wasn't expecting anything.
All right, so you're at home and you're still feeling this discomfort. What prompted you to seek help?
I called my next-door neighbor who was an ER doc at Ruby, and he said, you need to get to the hospital, and if you're not gone in 5 minutes, I'm coming over and calling 911. So I just thought, okay, I'll go. And I just started driving. And I got up to the intersection that turns off on Stewartstown Road, off of Point Marion Road, and started having pain shoot down my arm. And I thought, wow, this isn't good. This is the classic symptom here. So I knew then pretty much what was happening.
Did you drive the rest of the way?
Yeah.
And did you just go into the emergency department?
Yep. Walked in and said, I'm having chest pains and stuff. And next thing I know, the wheelchair's under me, and it's just boom, boom, boom. And I didn't know what was happening. And then he leans down over me, and I thought, this guy's 12 years old.
He looks 14 now.
That's why I called him Doogie, and I've always called him Doogie since then.
Nancy, is that common for people to just walk into the emergency room complaining of chest pains and having those classic symptoms?
It is, but one of the things that we like to stress is calling 911, because what can happen is people's heart can go into that funny little rhythm where it's not beating, and if they call 911, EMS can actually shock that heart. They can also start treatment that helps restore blood flow on the way in, but we like them to do that, because if that happens, and they're all alone, their chance for survival goes down dramatically.
My fear is, and I think, I think about, because I do these shows all the time, I'm always worried that my phone's going to be upstairs when I feel this sensation, and I'm going to have to go upstairs and get my phone. And I'm not going to be able to do it to call 911.
He's really thinking ahead, isn't he?
Yeah, you really are.
Yeah, I got to carry my phone with me everywhere I go, I think.
So you're pretty sure that you're on the verge.
No, I'm not. But every tiny little thing, even if it's, I don't know, just a little twinge of something in my chest, I'm thinking, no, not me. It's not my time.
Yeah.
But I go to the doctor regularly. I see the doctor and everything. But, I have the certain symptoms, overweight, diabetic, and doctor, maybe we'll get you in here on this. I mean, I constantly think about this all the time, just based on these certain symptoms that I have.
You know, Doc, Christmas is coming up, and I can see what I can get Jim. One of these little alert necklaces he can put around his neck and just push a button.
Now, we can get you some training on the defibrillator on the hallway. I think would probably be a better Christmas gift. So what can you say?
Yeah, I mean, anytime someone has a lot of risk factors, diabetes, high blood pressure, high cholesterol, family history, smoke, all those things put you at a lot higher risk of developing coronary disease. And if you have any symptoms that are concerning, especially with those risk factors, you definitely need to get checked out sooner than later.
Okay, well, I don't have all those risk factors. I don't have the high cholesterol. I don't have the high blood pressure. Actually, I take medicines for that. But see, I see like Rosie O'Donnell had 99% blockage. How could you not know that?
Sometimes things happen more acutely, and sometimes things are more slow coming on. Like in Eric's case, he had with his heart attack, he had an acute plaque rupture in the artery, and then what happens is a blood clot actually forms. Think of it kind of like a cut on your skin. But only inside the artery. So cut on your skin, your blood clots, that's good. Artery plaque in your artery ruptures, clot inside the artery, bad. It's not allowing any blood flow to get past that point. And that's
so
what
plaque is what blocks the artery. Right. When you say is plaque rupture, I mean just broke apart?
Usually it'll kind of crack or fissure, and then what happens is the inside of that, which is usually sort of a fatty substance, the blood comes in contact with that, and that's what starts the cascade of developing the clot.
Should have Eric had other signs before the pain actually started?
Sometimes yes, sometimes no. Sometimes people, if they have more of a chronic development and more, they may start noticing, again, shortness of breath when they do things, that chest discomfort or arm pain or jaw pain when they're trying to do things exertionally. In his case, it was probably more of a really acute event where he had that plaque rupture or fissure, and that just started things just that quick. Mm-hmm. And sometimes people don't have a whole lot of symptoms, and sometimes people don't have real classic symptoms. And actually, diabetics are one of the people that usually don't have a lot of the classic symptoms, as far as the elephant sitting on their chest or the arm pain or things like that. Women are kind of the same way too. They don't usually present always in the typical fashion. Sometimes they will have, again, just shortness of breath, sometimes just nausea, sometimes they'll, jaw pain, sometimes just not feeling good in general. Sometimes people think they've had the flu. And 3 or 4 days later, they realize, oh, hey, that wasn't the flu, that was a heart attack.
But I think you hit on something, and so did Eric. We ignore so many signs when we have them because we feel like, oh, it's indigestion, it's not really my heart.
Right.
And then it could be stress related as well. So we tend to ignore a lot of this. Eric did do something about it.
Yes.
So when he arrives at the hospital, you come in and see Eric. What do you do at that point?
Well, initially, the first thing the first thing you try to do when someone comes into the ER is get and complains of chest pain, is to get an EKG, electrocardiogram on looking at their heart as soon as possible. And with that, he had changes on the EKG that signaled that that's what was going on, that he was having a heart attack. So at that point, what you try to do is you try to get someone to the catheterization laboratory as quick as possible to get that artery opened up to decrease the chance of more trouble and more heart damage.
Those of us at the radio station in the hallway that day that Eric had his heart attack, we should have known something was up because he had a very good show that day. Very few mistakes, which was out of the ordinary. And so
we always thought it was the brain that would go first, not the heart.
Yeah, one of the radio signs of having a heart attack. We'll be back in just a moment. You're listening to Health Talk on WAJR.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
With us on Health Talk today is Dr. Rick Smith. He's a cardiologist, and his patient, Eric McGuire, retired from West Virginia Radio Corporation. Also, Nancy Orr, director of the emergency department.
Yes, and I wanted to ask Dr. Smith about causes. When Eric came in, what do you feel were the causes of this heart attack?
Well, for him, probably one of the biggest risk factors that he had was the smoking.
Smoking?
Yeah.
And, of course, that's still a factor, Eric?
No, it isn't.
still a factor for Eric. That must be difficult as a doctor in trying to reach a patient when you know that smoking or these things are causing more problems.
Yeah, it is. And sometimes, it is very frustrating. But, all you can do is really
It's an addiction.
Yeah, all you can do is really, continue to encourage people and really try to get it through to them that, that's something that they need to quit. And
You can't surgically insert a nicotine patch?
No, unfortunately not.
Eric, did you try after the heart problem to quit?
Don't judge me, Kay.
I'm not judging you. We all have our vices. I'm just asking that question because other people listening, I've heard that's one thing that leads them down the road to quit after a heart problem.
Oh, I know. Look, I know I have to quit. I've got the packs of that stuff. What's the pills that you take? And Chantix. I've got those, and there's been several times I thought, okay, I'm going to start these. And I just haven't.
Your voice is still great, though. I mean, the cigarettes are helping your voice.
Well,
thank you. A little better.
Thank you very much.
Yeah. So in this frustration of people that are smoking, that does lead to problems. And we've said that many times on this show.
Oh, yes. And again, not just, smoking doesn't just affect the heart. I mean, that's a huge risk factor for strokes and, lung disease and a lot of other things also. It's really one of the biggest risk factors and biggest problems to be able to try to solve for people when they smoke, because again, like you said, it's a serious addiction. And
all right, what is the cigarette smoke doing to the body that leads to heart disease? Is it the carcinogens in it, the nicotine? Is it the body's not being able to process certain chemicals?
What it does is it really affects the way the arterial wall functions, and it allows the arterial wall not to vasodilate or get bigger from the normal nitroglycerin production that your body makes. It also increases the inflammation process within that vessel wall, which is what really causes atherosclerosis or plaque buildup in the arteries. It's an inflammatory process, and smoking accelerates that. And
also the bad cholesterol, is that kind of the same thing?
That goes into it. The higher cholesterol, especially the bad cholesterol that you have, the more chance of that being deposited in the vessel wall rather than being used for other purposes. When you're a young child and when you're born, your bad cholesterol, your LDL cholesterol is about 30. When you get to be a teenager, it goes up to about, usually in normal people, about 50, 60. And they've actually done a lot of studies now recently that show that that's really where we're kind of designed to stay in that less than 70 range. And if you can get people to that range, especially afterwards, it really cuts their chances of having future problems down. And if you can keep people from having levels higher than that consistently, then it really cuts down the chances of progression or even beginnings of disease.
Yeah, not just smoking. Lifestyle plays a big part in all this, I'm sure. And we're going to talk about cheeseburgers, too. So not just cigarettes. Lifestyle does play a big part in if we're going to have heart problems.
Oh yeah. Again, the diet, exercise, those are very, very important aspects of things. And again, sometimes the diet and weight loss and exercise for people is just as hard as quitting smoking.
Sure, absolutely. That's why I say everybody has their vice. Eric, once you went in and they decided what they were going to do, which is it the door to balloon? Well, what is that exactly?
That's kind of you want to try to get people, like I said, once you recognize they're having a heart attack, you want to try to, from the time they come in the door to the time they get that artery opened up with a balloon or stent, you want to make sure that time is as fast as possible. And the goal, is less than 90 minutes, but we try to get things even done, even quicker than that. And we try to strive for a lot less than that.
And Eric, go ahead.
I remember this because you're under in that twilight stuff. You're not all the way under, so you're capable of kind of watching what's going on in and out of sleep. But I remember vividly, he woke me up and said, "Look at this, look at this." and had the monitor there and said, right here's where I inflated the balloon. Look, your heart was dark right there. Now it's light. You don't have any damage. And I remember that.
That's awesome.
That is.
Yeah.
Now, where do you go in, and is it done scopically?
You actually, most of the time, you go in through the femoral artery in the leg, kind of in the groin area. You can also go in through the arm, in the wrist, or the even upper artery in the arm. It's kind of operator dependent, and sort of acuteness dependent too.
So is there a camera on the end so you can see where you're
No,
going?
It's actually not camera. It's all done with fluoroscopy or X-ray. An X-ray
Okay.
dye. You inject X-ray dye via catheters into the arteries that supply blood to your heart, and then you're watching on screen everything fill up or not fill up in the case of an occlusion.
Is it like a little bicycle pump, then you're pumping air in there?
No, air is bad.
Oh, so what are you blowing up the balloon with?
Well, the balloon, it's a closed, the balloon itself is, it's a closed system, and you have you inflate the balloon, and then that inside the artery opens things up.
What do you inflate the balloon with is my question.
It's
It's
actually
already inflated?
No, it's a little device you actually turn it. It develops certain atmospheres of pressure depending on how big you want to make the balloon and how tight you want to.
Did you put laughing gas in Eric's heart?
No.
Okay,
No, they didn't. I can tell that already. And when does it come to the point where this is not going to work and then you have to go a step with surgery?
It just depends. Usually for more acute episodes like his, you try to fix what we call the culprit vessel, meaning the one that's causing the heart attack. Now, sometimes people have multiple other areas that need fixed that will actually benefit better from surgery than stent placement. Sometimes even, in the acute setting, if there's a significant problem, sometimes people still need to go directly to surgery even with that. Surgery is usually the choice for certain lesion types and lesion multiple areas of blockage. We're really been successful, and with the newer stent types and developments, it's actually cut down the need for surgery. But there's still a lot of people that still have good indications and need surgery, and that's actually their better choice.
Improvements all the time, I'm sure. And Eric, no comment about this. Does age play in part of any of this at all?
Yeah, it does. The older we all get, the higher chance that we have of developing coronary disease.
Wow, you better watch out, kid.
I knew it was coming. I just knew you could keep it down.
But again, I've also, age is not one of the only factors, and being young doesn't necessarily mean that you can't have problems. I've done more than one angioplasty on people that have had heart attacks that are younger than myself.
Yeah, my brother died of one at 39 years old.
And
so.
I've done people in their 20s, late 20s even.
You're listening to Health Talk, brought to you by Mon General on WHAR. Back in just a moment.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Time's running short. What about the post-heart attack era for Eric McGuire? Can he still run marathons and do those types of things, triathlons and the other things he was so fond of?
Oh, yeah. Yeah, he can definitely get back into doing that. I don't know that he'd be able to, but...
How are you feeling, Eric, really? I mean, how do you
as
feel?
far as the heart is concerned, I'm fine. I mean,
Still have some
I've
back
just got all
problems.
kinds of other issues, neck and back and
Brain.
spinal cord stuff.
Yeah.
Yeah. But there is a regimen of medicine that you have to take afterwards. Now, that Plavix stuff, was I supposed to get that refilled?
yes.
I tell you.
Okay.
I mean, really, for 60, you look pretty good, I think. And
54.
54.
oh, I'm sorry. Perhaps it has aged him a little bit, you think?
Maybe.
But for Mon General, that's the place to go in a situation like
Hey,
this.
Nancy, real
Yes.
quick, Heart Walk, when is that?
That is going to be October 27th, Saturday. It's at Milan Park. Registration's at 9, walk is at 10. Anybody interested can give me a call at the hospital, 598-1202, and we'll set them up so that they can join us. We want to reduce heart disease 20% by the year 2020. We're working very hard on it. And projects like this raise money for research that lead to projects like Door to Balloon. And I really want to thank Eric for stepping out, because celebrities that come out and say, you know what, this can happen to anybody at any time, and thank you.
Thank you,
Very
Nancy, and thank you, Doctor. Thank you, Eric.
Thank you.
Thank you,
And you've been
Jim.
listening to
luck.
Health Talk, brought to you by Mon General Hospital. Stay tuned for Morgantown AM coming up after the news on 1440 WAJR.